Okay, it's been a long day and a great day, right? So let me first thank all of our speakers and Debbie and her planning committee and IOM staff, particularly Darla, but also Alina, Colin, Drew, and anybody else I've forgotten for pulling all this great day together. So we've now got a period of time. It will absolutely not go past 5:30, and we'll see how far it goes because it's going to be up to you. This is a tradition that we do in our workshops where we actually now, I know you've all made thoughtful comments and questions during the day, but as you know, we'll be turning this all into a summary report, and this is a time where we're going to ask ideally all of you, or at least some of you, to come to the mic and give us kind of summary thoughts, reflections on the day that are on your mind, that you'd like to get on the record here, and that could appear in our report as we write it up. So that's what we're going to do. I'm going to say a few things, and then Jacqueline's going to say a few things, and then we'll go into soliciting those questions. So that's what we're about. So it is a great day, and like all these workshops, I mean, I hope maybe like you, at the end of the day, my mind is sort of buzzing with not only everything that's happened and what to make of it, but also how to fit it into the journey we've been on already, which for those of you that aren't members of the Roundtable, this is our 10th workshop, so we've been through 10 days like this, and with equally challenging insights and thoughts and experiences in a whole variety of other sectors. So this is called, the Roundtable is called Population Health Improvement. If it was just called Population Health, could be a scholarly maybe activity or whatever. But we're about improvement, and that's what brings us into this scale and scope. The fact that, as George mentioned, I guess, a year ago, we had a whole workshop on catalyzing movements. What can we learn from previous movements, that sort of what works, what doesn't work, how do they come together? That was a great learning. So we're about that. And, you know, in our vision and mission, I mean, we have the words, catalyze urgently needed action. I mean, that's an underlined phrase. Requires robust community and national policies and dependable resources. Those are right in our mission and vision statement. So we are about change, and we are about these struggles that we heard about today, you know, to get to change. George, so we have a set of outcomes. They're not exactly what our last speaker sort of challenged us to, I mean, to their specificity or sort of daily run chart tracking, but we have some broad objectives in the length of life, the quality of life, the costs. You know, I must say, I wonder today, thinking about that, I mean, I think those are useful to frame, but I mean, whether those speak to all of our audiences, whether they're the most motivational, whether we have some work to do in extending that, is in my mind. And then George also mentioned we have these 6 drivers. I mean, we're kind of stuck with those, although we can change anything that we want. I mean, you know, but so far we've found useful. But they are metrics, resources, policy, science, relationships, communication. And I sit here today thinking that those are all still right, but that there's something else being asked here for today, and to sort of, you know, pull those together into an action framework. So, and if, actually even the last talk has made me worry a bit about, I mean, I don't think necessarily we've spent too much time on excessive strategy. That was a traditional line on the chart. But certainly, I mean, the bias towards getting started, or that action component. I mean, I think we have still, I think, maybe have some strategizing work to do, but I think we've got a lot of work to do on the getting started and catalyzing action. And it is complicated for us because we do not run all these multiple sectors that need to change in order to change. So I think, as Don Berwick said, that's a particular challenge for which we probably need to find some bright spots where there are examples. I mean, I really think a lot about the Robert Johnson Prize communities, where at local levels, multi-sectoral partnerships come together at least to go on an improvement path. So those are my only observations, and now I'm going to introduce Jacqueline Martinez-Garcelle, who's Vice President of the New York State Health Foundation. She's co-chair of the Planning Committee. She'll make a few observations of her own, and then she and I are going to pull it out of you to get your thoughts and observations on the record before we adjourn at the latest by 5:30. So, Jacqueline.